I've had 3 children, all natural, 3 different doctors, 3 different hospitals, and each time, each experience was a little bit different.
My experience was very positive. I had very great midwives for both births, and throughout my whole pregnancy, each midwife that I was seen by had very positive things to say to me.
The first one, they tell you everything that's going to happen. They give you Lamaze classes and explain everything. The second time, not quite so much. And the third time, for sure they don't. They think you're a pro at this. But when your children are 4 and 5 years apart, you tend to forget a few things.
So I have 2 children. I have an 8-year-old son and a 3-month-old daughter. I delivered my son in June of 2010. We had problems from the very beginning with him, just trying to stay pregnant. And I switched care providers 3 times.
Between 2000 and 2014, maternal death rates increased 27% in the United States.
He tried to come early and nobody wanted to listen. Nobody wanted to hear any of the symptoms that I was having. I was 20 when I got pregnant with him. I was 21 when I delivered him. And I think I was young and I just wasn't taken seriously until the 3rd doctor.
American women are 3 times more likely than Canadian women to die during childbirth.
So with my first child, my daughter, I had a very normal pregnancy. For my second child, very similar situation. However, my son took forever to come. I got to the hospital, I was 7 centimeters dilated, and it should have been quick and easy. And then I had back labor, and my son was not born until about 8 p.m. that night.
With our daughter, she was born in December of 2018. It was the same doctor, a phenomenal doctor who had been with us on our 5-year journey to get pregnant with her and 2 miscarriages and just was supportive.
In New York State, the maternal mortality rate has risen 60% in the last 10 years.
Both my experiences were so different. In one case, I had nobody that took me seriously. Everybody opened my chart, saw that I was young, saw that I was plus size, saw that I was not married when I got pregnant, and assumed things when that just wasn't the case.
Any issues that I may have had, such as weight gain, I had high blood pressure once, different things like that, they were all very well addressed and explained to me in a way that I didn't feel nervous or scared that something was wrong.
According to the CDC, up to 60% of these deaths are preventable.
I came away from both births feeling very confident in myself. And I believe this was for 2 reasons. The first reason being that I felt informed throughout my whole pregnancy by the midwives.
As a woman providing care for other women, I see how significant the need is for an increased focus in maternal health and outcomes. I can't tell you how many times I've had to advocate for safe care, evidence-based care, and care for a woman who chooses to birth in a particular way that she wants to experience.
With my daughter, I was 29 years old. And I've been with the same doctor for 5 years. That's a relationship that had been built over time. But I don't think that matters. I think that regardless of someone's age, size, race, ethnicity, anything, they should be taken seriously when they come in with a complaint during their pregnancy or when they come in with a question during their pregnancy. And I don't think that's happening, and it's so frustrating.
While I find myself as an advocate for women of all backgrounds, I do see that younger women, poorer women, and women of color are listened to less, are taken less seriously, and do experience poorer outcomes or birth experiences than other women.
Yes, you went to college. Yes, you're educated. We understand all that, but not every person that walks into your office is not educated. Not every person that walks into your office doesn't understand what is happening with their body and doesn't have a genuine understanding of what's going on. And those things deserve to be respected. And I hope that as healthcare evolves, that certain things will change.
We can't afford to wait any longer, and our moms can't afford to wait any longer to start addressing the maternal mortality crisis in the United States.
In the hospital specifically, I felt very well informed when I had to do my interventions, and I also felt very comfortable with the decisions being made by the midwives and by myself, because the midwives really explained everything to me and made sure that I felt comfortable.
Women should be able to go into pregnancy and going into childbirth and go into a hospital to have their baby and feel safe and protected. It's a normal, natural part of being a woman, but in the United States, there's still an increasingly high risk of having a baby of having death or injury.
I think that midwifery care should not be an option or a choice you can make, but should be standard care for laboring mothers. Midwifery is centered around the patient and the baby, and understanding that each birth is completely different. No birth is textbook and no birth is the same.
The 2019 Moms Act is going to create evidence-based safety bundles that will be implemented at different hospitals and give the staff the training and the resources they need to respond in emergencies, to provide the best care. It's going to decrease disparities across the whole, from prenatal to postpartum, during childbirth.
I feel that standard care and standard practice should be patient-centered, and it is. Overall, doctors and nurses look at the patient and say, what is the best for this person? But they also have a timeline that they kind of stick to, and that kind of oversteps or becomes more important than a specific person.
The CDC estimates that out of the 50,000 women who have complications during pregnancy, 60% are preventable. We can help to prevent these things by supporting the Moms Act.
The impact of the Moms Act would be that women of all backgrounds in all areas would be provided services, hopefully, that would be more standardized and higher quality, because the Moms Act would roll out resources to all areas, hoping to decrease some of those disparities in care.
High blood pressure, cardiac disease, safe postpartum care, safe reduction of primary C-sections, reducing disparities so that all women, regardless of their education, where they live, the color of their skin, can have access to safe, evidence-based maternal care.
The Moms Act would also provide an avenue of accountability so that providers and facilities would be held responsible for their outcomes, motivating them to change their practice or improve their practice. And it would also allow this data to become transparent to the public so that women and their families can make informed choices about where to get their care and who to get their care from.
In addition to promoting safe births for women in the United States, this will also support a culture of empowering women throughout their prenatal, birth, and postpartum process so that they can be partners in their care and they can create educated and informed decisions in partnership with their healthcare providers. Please reach out to your legislators, let them know that moms matter to you and your family and that we are serious about making a difference so that all women can deliver safely in the United States.